All right. Hi, everyone. Thank you so much for joining us. And happy APA Heritage Month and happy CACF Annual State Advocacy Day. I'm so excited to have everybody join us here on Zoom and on Facebook Live as well. I'm going to give a bit of an introduction before I introduce some of our speakers for today's virtual teach-in. So yeah, it's APA Heritage Month. What better time to discuss the community needs of our APA New Yorkers? CACF is so excited to host this virtual teach-in. On our annual State Advocacy Day, we will be hearing from our elected state leaders, as well as our community-based organization members who work to mitigate these inequities that we see every day. Working with almost 50 member organizations to identify and speak out on the many common challenges our communities face, CACF is building an APA community too powerful to ignore. COVID-19 has exacerbated long-standing and interconnected crises in socioeconomically disadvantaged communities. While unfortunate and heartbreaking, this was not entirely unexpected. There are currently 1.6 million residents of Asian descent, comprising 8% of New York State's population. Yet the needs of APA community members are consistently overlooked, misunderstood, and uncounted. We're constantly fighting the harmful impacts of the model minority myth, which prevents the community's needs from being acknowledged and understood. This means that our communities often lack the resources to provide critical services for those in need. Never has this been more apparent than right now. We believe that in order to achieve an equitable healthcare system for all New Yorkers, we have to begin by taking steps in data disaggregation, language access, cultural competency, and universal health coverage in healthcare. While I could probably do a monologue on all of those things, I think it would be much better to hear from our community organizations on the needs that they see on the ground as social service providers. Their voices and experiences are invaluable, and I am happy to introduce our first speaker. I hope he's on. I can't quite see all the participants at the moment. Cameron Nan, Campaign Director for Mekong NYC, an organization that aims to improve the quality of life of the Southeast Asian community in the Bronx and throughout New York City. So Cameron, you can take it away.
Thank you so much for that, Hallie. Hello again, this is Cameron An. So thank you for the introduction. And I want to also thank the opportunity for being on this teaching with all these amazing leaders that are here today. And I'm happy that, one of the things that we talked about was like highlighting the impact of, the landscape that's going on right now around COVID-19. And it's really forcing us to shift, rethink, and really respond to the immediate needs of our community. And so I really wanted to start off just talking about that really quickly and how COVID-19 has really highlighted some of the socioeconomic and health needs that have already been some of the key issues that organizations have been organizing around. And so for Mekong, how do we address safety net programs and resources alongside of that? And particularly with that, I wanted to talk about the data disaggregation piece. It's really important how we think and talk about unpacking accurately the different issues and things that we address in all of our communities: language access, health access, social service needs, and really talking about the needs for a growing and diverse APA community throughout New York State and the country. And part of the thing about data segregation is around really understanding what does that mean? Oftentimes, small communities like Mekong, particularly the Cambodian Vietnamese immigrant refugee community, get lost in these numbers. Like many other communities, we have a large spectrum of APA communities, different ethnic backgrounds, different ethnic history, different culture needs. And so if we're not really understanding the different ethnic communities and languages that these groups in this spectrum looks like, it's hard to really allocate the resources that are needed to support that. And so secondly, talking about how the data piece around data segregation is so important is along the language access piece. We understand and know that APA is one of the fastest growing populations in New York State and around the country. And so what are some of the things that we're doing to address those things? Understanding that there are over 800 languages that are spoken in New York City, how do we understand what are some of the language barriers and access to that? I think, we often talk about how language access and cultural competency is so important, and they play hand in hand in really addressing what those things look like. And so I wanted to spend time and again, like giving space for our colleagues to share and seeing how these things are so important, talking about, data segregation, making sure that everyone, we're really addressing the invisible normal piece, really understanding the language access piece around the loss in translation, and really addressing health equities that a lot of the groups that are here are fighting for. So I wanted to thank everyone for that. Thank you.
Thank you so much, Cameron. And we have some electeds on the Zoom meeting right now, and I wanted to introduce Senator John Liu, if you wanted to speak at all to any of the points that we've brought up, or just say hi.
Hey, Hallie, how are you? All Gucci? Good. I'm so happy to see everybody here. It's hope you can hear me because I can't tell if I. All right. All right, good. Thanks, Gene. Although we got to be careful about this thing nowadays. This is better. All right. This is a little questionable nowadays, but nonetheless, I'm very happy to see all of you. Some old friends, and when I say old, I do mean old, right, Vanessa? Right, Wayne? And some new faces, including some young activists. We always want more people to be involved. And, I think we had a really good hearing yesterday. It was a very long hearing. I was on for about 5 hours. Wayne spoke very eloquently, as well as a number of other leaders, and Assemblymember Epstein was on with us as well. So I was happy that we were able to have a full-blown hearing yesterday, talking about the disparate impacts that COVID-19 has had on our communities, particularly communities of color. And I think we can all agree that the Asian American community certainly is a community of color, one that has endured disproportionate impacts from COVID-19, both from the virus itself, as well as from the plague of hate that has really victimized far too many people in our community here in New York and all across the country. Donald Trump not helping the situation at all by referring to COVID-19 as the Chinese virus or the Wuhan virus. But nonetheless, we are all here to figure out how we can confront this problem or the myriad of problems that our community faces. And that includes a number of different things that I'm sure maybe we didn't actually discuss yet, but certainly will come up. Data disaggregation, for example. You look at the screen. I mean, I see 25 boxes, and if I scroll over, there's many more boxes. And look at this. This Zoom screen shows that the Asian American community certainly is not homogeneous. We're very diverse. We have a lot of different backgrounds, racial, ethnic, religious, cultural. And so it's time that government stop treating us as one big monolith and recognize the different kinds of challenges we all have. So great to see all of you here. Wayne Hull continues to talk about data disaggregation. We have a huge champion in Yulin Neo in the State Assembly, Harvey's colleague, and I know he's supportive of that as well as a champion in my chamber who is Julia Salazar. So we're trying to get all those things repassed and not vetoed this time, because we passed it last year, but unfortunately Cuomo vetoed it. So that's one of the fronts. But there are so many other issues that I know you'll be talking about. I don't want to take up all the airtime. I do want to acknowledge that I'm joined on this call by Shang Liu, my legislative director, and many of you have worked with him very closely. So with that, I will be on to mostly to listen as opposed to speechify. And Hallie, again, thank you for your efforts in getting all of us together.
Thank you so much, Senator Liu. We really appreciate you being here and being a voice for the APA community. It's fantastic. So I want to continue with some of our community members because as the senator mentioned, they do have a lot more to speak on. So I would like to introduce Jihye Fisher, the Executive Director of the Korean American Family Service Center, which is a nonprofit providing counseling, education, and advocacy programs for individuals and families throughout the New York area in a culturally and linguistically appropriate setting. And they'll be speaking a little bit more to how they do that and why it's so important.
Region, Mekong NYC previously mentioned, we have witnessed language and communication problems leading to dissatisfaction, poor comprehension, and lower quality of healthcare for the APA community. However, language access is merely a single facet of cultural competency. Cultural competence in healthcare is the ability of providers to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. Individual values, beliefs, and behaviors about health and well-being are shaped by various factors such as race, ethnicity, nationality, language, gender, socioeconomic status, physical and mental ability, sexual orientation, and occupation. The cultural competence in healthcare is to understand and integrate these factors into the delivery and structure of the healthcare system. The goal of cultural competent healthcare services is to provide the highest quality of care to every patient, regardless of race, ethnicity, cultural background, English proficiency, and literacy. According to a recent report by the Health Policy Institute that we found, compared to other minority groups, Asian Americans are least likely to feel that their doctor understood their background and values, and are most likely to report that their doctors look down on them. To increase the cultural competence of the healthcare delivery system, health professionals must be taught how to provide services in a culturally competent manner. An approach that focuses on curiosity, empathy, respect, and humility throughout the care process is what we need for our APA community. Although many different types of training courses have been developed across the country, these efforts have not been standardized or incorporated into training for healthcare professionals with consistency. A cultural competent healthcare system can help improve health outcomes and quality of care, and can contribute to the elimination of racial and ethnic health disparities. Therefore, support the passage of S06767, which requires cultural awareness and competence training for all Medicare professionals as part of their licensing requirements, and a community health improvement plan for its region, improving the quality and accessibility of care for our APA community. Thank you.
So I mentioned to some of our members that during this virtual teach-in, I was going to drop in some tweets that you guys could copy and paste into your own Twitter, your organizational Twitter, that have to do with what we're talking about, targeting the New York Senate and Assembly to take some kind of action on behalf of the APA community. So I'm going to put the text in first and then add in an image that speaks to the data disaggregation piece, exactly what we've just heard multiple times, that you can see just based off of everybody on here that we're not a homogenous group, right? Like we have so many different communities within our own community. And I would like to thank, sorry. I would like to thank Assembly Member Harvey Epstein for joining us as well. Really appreciate having our state officials here, it is great to have voices added to our fight. So thank you, Assemblymember Epstein. If you wanted to speak to anything, you are more than welcome to.
Thanks. I'm just gonna take up 1 minute. You know, Senator Liu said it all. It's really important that we understand the impact, you know, of COVID-19 on the Asian American community. If we looked at the data that was released in the Times yesterday and today, clearly two things that matter about our race and class, and those are huge issues in the Asian American community. And so we as New York State legislators need to do a better job understanding what we should be doing to ensure economic and social power for communities that have been historically discriminated. And this is clearly the part of what we see in Asian American. This myth of the model minority is something that's, as we say, a myth. And there's even so many people in my district who are Asian American who are living in poverty and doing very well, and they cross the spectrum, and we need to support the entire community. And I look forward to working with my friends and colleagues, Assemblywoman New, who's been a leader in my chamber, and Senator Liu, who's been a leader in the Senate over his short period of time, to ensure these issues get the full hearing. Like you said, we were at a hearing, I think I left probably by 6:30, 7 o'clock last night, the hearing, and these issues are clearly apparent across the state, and something we need to all grapple with as we move forward and getting back into session, which we need to do right away so we can pass really critical legislation. And thank you everyone for being here and doing what you do for this community and for my residents.
Thank you so much. Yeah, I think it's really important that we have this platform right now. And like you said, all of our champions, they've been great. And right now it's more important than ever that we have our voices heard by the rest of the legislature. And that hearing was incredibly long, and did have some of the points that we are raising here brought up. I think one of the ones that hasn't been mentioned, just because it's a little more nuanced, is has to do with a specific population under temporary protected status within the healthcare system. And I'm going to let someone who knows a little bit more about that in their work talk about that. Sandhya Pradhan, the Health Navigator and Program Assistant at Adhikar, an organization committed to improving the lives of the Nepali-speaking community and getting voices heard in the social justice movement. So thank you, and Sandhya, take it away.
Thank you, Hallie. Namaste and good afternoon. My name is Sandhya Pradhan. I am a health navigator at Adhikar under the Patient Navigator program with CSF. Thank you, CSF, for giving me the opportunity to speak today. Adhikar is the only women-led worker and community center serving and organizing the Nepali-speaking community on workers' rights, immigrants' rights, access to healthcare, and language justice. We are one of the newer and most rapidly growing immigrant communities in New York City. Nationally, a report showed that there was a 207% rise of Nepali immigrants in the US over the last 10 years, the highest of any other population included in the report. Adhikar is located in Woodside, Queens, and serves more than 10,000 people a year. Our members who are domestic workers, nail salon workers, restaurant workers, Uber, Lyft drivers, and other informal industries mostly lives in Jackson Heights, Woodside, Elmhurst, Sunnyside, Ridgewood, Jamaica, and part of Flatbush, Brooklyn. Organization working on healthcare justice. We also support people from many other parts of the state. We are the epicenter of the COVID crisis. This has had severe impacts on our community for the last 2 months and will change our community for the long term. We have served almost 2,000 individuals with direct service needs in the past 2 months, addressing things like unemployment benefit, support, healthcare legacy, access to government resources, and emergency funds, medical and food supplies. We hard, but unfortunately, the Nepali-speaking population is often lost in data collection without disaggregated data of the API community. This data is used to create policies, provide services to migrant communities, and distribute funding for service providing organizations like Adhikar. With better data that shows the diversity of the API community, we can ensure that the community like ours that are the most impacted by this pandemic can survive and recover. This is why there is a need to establish a healthcare disparities data collection system that will literally save lives in our community. Another thing we have seen is that the movement calls for swift action from the state to ensure that all New Yorkers have quality health insurance, regardless of immigration status. We work with thousands of Nepali TPS, temporary protected status holders in New York, all of whom are in limbo right now due to a pending federal suit that has kept their status on hold. Now is the time to ensure that we will not lose health care coverage even if the federal program is full. There exists legislation currently that would ensure this, and we ask state legislature to pass this immediately. We also voice our support for coverage for all and New York State Health Act to ensure that no one is denied quality health access and care due to immigration status. I urge the New York State legislature to act now this recommendation. Our communities are living day to day in fear, and organizations like Adhikar are working day and night to ensure that they do not fall through systematic gaps. These policy measures will be the difference between life and the death for immigrant communities, and we will continue to fight for them so that they can live a quality and healthy life. Thank you.
Thank you so much, Sandhya. Um, we just had Assembly Member Yaleen New join us, and she's been an incredible advocate for us and our community, and we would love for her to take a moment to speak on behalf of the Asian Americans in New York.
Oh man, that's a pretty heavy load. All the Asian Americans in New York.
All of them.
Well, that's actually a really good point right there that we should make. So I'm actually here to speak a little bit about the data disaggregation bill that CACF has been pushing for so many years. And I also wanted to note that Wayne Ho is on this call, and I still remember when he was first talking to me about it as a new graduate from Baruch's CUNY, and like I came to one of his things and he spoke, and I was like, oh my gosh, data disaggregation. It was such a key moment for me because I actually wasn't very cognizant of how important it was for our data to be disaggregated until that moment. So that was like 10 years ago. Wayne, you got to give yourself some props on that. But I do want to say that, last year, our bill on data disaggregation actually passed both of our houses. So we actually have the votes in both houses to pass this bill again, but the governor vetoed the bill, and it was ultimately not signed by him. And we're still talking. They said that the biggest holdup was fiscal, and yet I'm not really sure where it is fiscal. So just so that we are clear, we can run through it a little bit. But right now, the bill requires every state agency, board, and commission, and it's basically requiring that the collection of certain demographic information by these state agencies strives to improve the understanding of our different communities, right? And I think that right now we have, in New York alone, we have over, like 60 different Asian ethnicities and from 40 different countries. So I think like this is, obviously we're not sure exactly because we're not disaggregating our data, but currently our data collection is only divided into Asian American or Pacific Islander. That's it. And so under this bill, the categories would be divided into a lot more specific categories. And this legislation is really crucial, I think, because we really need to make sure, right now in the time of COVID, we've already seen that we can't tell where Asian Americans are not being serviced. And we can't tell where and which of our Asian American groups are actually dying and getting sick. And where our communities are needing the most help. And so right now we already know Asian Pacific Americans are literally the most impoverished ethnic group in New York City. And I'll let that sink in for a bit, right? Asian Americans are the most impoverished ethnic group in New York City. But having data collection and using the umbrella term, such as Asian American, erases a lot of the poverty and then puts us under one giant umbrella, right? And it makes us one monolithic group. And when our state doesn't actually disaggregate this data, it paints a very misleading picture and suggests that Asian Americans are, as a whole, very successful, right, as they call it, because we have good graduation rates or whatever, and then people are in schools or et cetera. And I think that eliminates a lot of the conversations that need to happen about what is actually going on, who's actually getting social benefits, what's going on in our budget, what are some of the things that are not included in our budget. And I think that, Wayne actually just yesterday was testifying on behalf of CPC for a public hearing on basically just like how COVID-19 has affected minority communities. Well, obviously in some ways in the Asian American community, we've seen a lack of resources, but that's not surprising because we already see a lack of resources, right? In our budget, we've never even seen the word Asian till like 2 years ago. So, I mean, that's crazy, right? When we were able to double the Asian American representation by electing into office, and that would make us 2, and then now it's 4. So like every single year we're doubling. That's good. It's like a 200% growth. And so we just want to say that, by implementing data disaggregation, we should be able to shift that conversation and focus on really revealing some of the realities that our communities go through, right? And stop really, I guess, hiding the conversation by misleading folks into thinking that everybody's fine, right? And it's not true. And I think that this is one of the biggest difficulties that our community has in some of the dialogue that we need to have going forward, because a lot of folks don't realize that Asian Americans are the most impoverished ethnic group. A lot of people don't realize that we are also the largest undocumented community. We also have a exponentially growing undocumented community and an exponentially growing poverty rate. And people get trapped into cycles of debt because of the lack of language access. People get trapped into consumer fraud because of the language access issue. And people don't even realize how prevalent some of these cases are, and how prevalent some of these issues are, and how much our seniors and how much our parents and how much our communities and small businesses get taken advantage of. And they don't know where to report. They don't know how to report. They don't know where to seek these benefits. And I wanted to give props to some of my colleagues on this call. I see John. I see I see Harvey, and I wanted to say thank you to both of you, and thank you to my other colleagues like Kevin and Ron, who have been very outspoken about making sure that we have better representation. And again, I want to thank CACF, and of course, like the crew has been fighting really hard on this bill, and we finally got it passed. And it's just really unfortunate that we couldn't get that last step in. And so we're going to continue to fight. I think that really this year it's really important. One more thing that I have to add is to fill out your census. We need to fill out that census. It is insane. We've had extra time and we can't fill it out. Like I don't know what's going on. Like it only takes 5 minutes. We need to remind folks that yes, it's scary. Yes, it's hard to take that plunge, but it's okay. We're going to make sure to protect them. And like, it's really important to fill out the census because we're leaving money on the table. We're leaving money on the table for our communities. We're leaving money on the table for our state. And like, we need to make sure that we fill out the census. And our community is one that needs a little extra help on that front. And having data disaggregation, we would know exactly what languages every single community would be able to need to be able to get that census filled out. But unfortunately, we have to do it through our community service organizations and our nonprofits and the folks who know the folks on the ground. So I just want to say thank you again for all of the work that you do and for making sure that we continue to keep on this fight.
Thank you, Yulene. Thanks for not calling me uncle.
Grandpa.
Thank
Okay.
you so much. We
Vanessa,
always
I'm sorry, I
enjoy
just have
having
to,
y'all. Oh, go for it.
I have to warn Vanessa. Vanessa, you've got
Yes.
glass picture frames and people playing basketball in the same room.
I know. Do you see that? Well,
Yes.
he's here. Oh, and actually, you want to see my my oldest now is 12.
Oh, whoa.
Better you remember holding him at the Kappa Fair 12 years ago.
Oh, gosh. He's so big now.
My little one, we'll just do a little with his hair messed up and his Star Wars Christmas pajamas.
That means we've been fighting for the data bill as long as your kid has been growing up.
Correct. We've been in it. We'll make it happen.
It's been a decade. We can do it.
We can do. Oh no.
But I think one of the important things that Elaine just brought up too is that we do have to hear from our community-based organizations, right? Like we don't have the data, and so their voices on behalf of their clients is so critical for us to understand how best we can serve our communities. And to speak more to that, I'll move on to Gurvinder Singh, who's the Global Aid Director of United Six, which is a UN-affiliated international nonprofit humanitarian relief advocacy organization for minority communities around the world. So, Gurvinder, if you can take it away.
Yes, first and foremost, thank you, Haley, for allowing us this opportunity and giving us this forum. As you know, you so gracefully stated, my name is Gurvinder Singh. I'm the International Humanitarian Aid Director for United Six, and it is an honor speaking before CACF and the Coalition for Asian American Children and Families, because this is needed to amplify the voices of those on the ground and those who are dealing on a daily basis with our communities, to let people know exactly the trials and tribulations we face on a daily basis. United Six was founded in New York, and our headquarters is located in the Big Apple as well. In fact, we've delivered over 100,000 meals to impoverished, vulnerable communities, and mostly the Asian communities, because of certain dietary restrictions that they have, that they're not able to access from other means and other norms. So what we're doing is we're asking you to co-sponsor the bill known as S22406A, and that's on cultural competency that seeks to reduce healthcare disparities and improve medical outcomes by requiring cultural awareness and competency training for medical professionals. Now, this legislation is going to play a crucial role in ending statewide health disparities among minority populations. And in doing so, this bill also seeks to improve the quality of healthcare in the state of New York. The bill is currently passed in the New York State Senate and currently awaits a vote in the Assembly, and we're confident it will be passed. And when it does get passed, I will speak in a positive tone. It will bring about a substantial and welcome change on minority groups' healthcare concerns, including our Sikh community. We have recently been receiving reports from Sikh medical professionals all across North America and the world, wherein several Sikh doctors on the front lines of this pandemic have had to make the unfathomable, unimaginable choice of cutting their beards. Now, we practice allowing one's hair to grow naturally out of respect for God's creation, and it's a part of our identity. It is who we are as an individual inherently. Now, that's being asked to wear an N95 mask and continue treating COVID-19 patients, or several doctors were also removed from their usual shifts at hospitals for refusing to shave their beards. It's understandable. If you're not going to allow someone inherently to profess who they are, then it becomes difficult for them to do anything. And all this happened despite having a feasible option of wearing PPE equipment called PAPRs, which is powered air purifying respirators. So that's a hood-like headgear that goes over the face and doesn't require practicing Sikhs or any other minority religions to shave or trim or cut their beards. Now, this is just a small example of how cultural ignorance and insensitivity has led several Sikh healthcare workers to an unfair and, again, an unfathomable choice between practicing their faith an identity or continuing on with their profession. Now, this bill is especially important to be passed in New York since it is one of the most diverse states in the nation. It's the one with the largest population of historically marginalized groups. It is well documented the legislature can help enhance the quality of healthcare services in underserved communities. And also that, again, I would like to reiterate, these are those same frontline warriors who we clap for. These are the same frontline warriors that we appreciate. You know, when we talk at the dinner table, these are the same frontline warriors that we hold in our prayers. But we must come together to ensure and initiate substantive action to allow these frontline warriors to practice and protect. So in closing, I would like to thank CACF once again for inviting us today, giving us this opportunity and this platform to advocate so that New York's private and public health, education, and human services institutions can adequately serve the growing number of Asian, Pacific American, and immigrant families. Thank you once again. May God bless us all, and may we move forward and look forward to a positive and tangible result on this bill. And may we all stay safe. May we all stay well. God willing, everyone. Thank you once again.
Hey, Hallie, may I just say something real quick about Gurvinder's comments? Gurvinder, last year, you may be aware, because United Sikhs was part of our coalition that passed what we call the Religious Garb and Attire Bill, which specifically prohibits employers from discriminating against anybody in hiring or promotions on the basis of their need to wear certain religious clothing or wear their beards, as most Sikh men do. So what you're describing, if that happened in New York, would be a clear violation of that law, in the guise of health emergency. I would like to get more information about that offline. Thank you.
We will certainly be in touch. Thank you, John.
Yeah, I was just about to mention that. I wanted to make sure that you finished because we actually passed the law. This is Jamal Bailey and folks who really fought hard for this. And actually the Sikh community was actually a big part of it. So I think that we need to see if that actually violates our actual law right now that we passed a year
ago. Signed by the governor in this case.
Signed by the governor.
Yeah.
Okay.
And I mean, we've been seeing how his EO on wearing masks has actually become very much stop and frisk, and so and has really kind of been geared towards violence towards Black and Brown communities. And I think that it's really important that we speak out about that as well, because in our Asian American communities, we've seen people get violence for wearing a mask, for not wearing a mask, for just
for breathing,
existing.
Yeah. So, how dare you breathe?
How dare you walk around with this face? And so I think that we need to actually check on, because we actually talked about haircuts, hairstyles. It's all in the law actually, and facial hair is also part of it. So and it's in it word for word. So we should talk about that for sure.
Guys, I think it's great connecting on this platform. So I want to introduce one of our last, our last community speaker, who kind of will round this out and bring it into also a need for just a larger need for all New Yorkers on the case of universal healthcare and coverage. And that's going to be Wayne Ho, who's the president and CEO of the Chinese American Planning Council, or CPC, which is the nation's largest Asian American social services organization and a longtime partner of CACF. So Wayne, whenever you're ready, go for it.
Thanks, Hallie, and thank you to CACF and all your staff for organizing today's State Advocacy Day. We know during this uncertain time, it's important for the APA community to stand together and send a common message to our legislative leaders from the Senate to the Assembly to the governor's office. So I just want to recognize you all at CACF for organizing today and us standing together with our partners. I see Vanessa and Anita and Andrea and Denise and Jean and others on here. So I can't figure out my grid form to see everybody's names, but I just want to recognize you all for doing this. I also want to recognize and thank Senator Liu and Assembly members New and Epstein, and I think I saw Irene Chu from Assembly member Abate's office for joining us. Thank you all for working with us. So just imagine quickly that during a pandemic where you see your neighbors dying, you see on the news that your family members and friends and loved ones are getting sick and dying, but you are refusing to go seek care. You imagine that you're in the middle of a pandemic and every day the governor or the mayor has an update, but you're not getting the information in a language that you understand. Imagine that you are struggling between trying to pay your rent or am I going to pay my medical bill? Imagine that you have a friend who lives in a nursing home and they are getting sick or someone else who has COVID is coming back into the nursing home. Imagine that you